In late 2019, a novel coronavirus emerged in Wuhan, China, marking the beginning of a global health crisis that would change the world forever. The first cases were reported in December, with symptoms resembling pneumonia, but it wasn't until January 2020 that the World Health Organization, or WHO, officially notified the public about this mysterious outbreak. As the virus spread rapidly, it became clear that this was not just another seasonal illness, it was a new pathogen that posed significant risks to global health. Understanding the origins of COVID-19 is crucial for several reasons. Not only does it help us comprehend how the virus jumped from animals to humans, but it also sheds light on the factors that contributed to its rapid spread. By examining these events, we can better prepare for future pandemics and implement effective public health strategies. In this video, we will delve into the timeline of COVID-19's emergence, exploring the key moments that led to the WHO's declaration of a public health emergency. Join us as we unpack the significance of this pandemic and why it's essential to learn from its origins to safeguard our future. In December 2019, health authorities in Wuhan, China, began reporting a cluster of pneumonia cases that puzzled medical professionals. Patients exhibited symptoms such as fever, cough, and difficulty breathing, which are typical of pneumonia but were unusually severe for the time of year. The initial cases were linked to a seafood market in Wuhan, raising concerns about a potential infectious disease outbreak. By late December, the number of reported pneumonia cases had increased, prompting local health officials to investigate the cause. On December 31, 2019, the Wuhan Municipal Health Committee officially reported 27 cases of pneumonia of unknown origin, with several patients requiring intensive care. The geographical context of Wuhan is significant. As a major transportation hub in central China, the city's connectivity facilitated the rapid spread of the illness beyond its borders. As the situation unfolded, it became evident that this was not just a localized outbreak. The severity of the pneumonia cases and the mysterious nature of the illness led to heightened alarm among health officials, setting the stage for what would soon be recognized as a global pandemic. As the pneumonia cases in Wuhan began to escalate, the World Health Organization, or WHO, was alerted to the situation by Chinese health authorities. On December 31, 2019, the WHO received a notification regarding the cluster of pneumonia cases, prompting immediate attention. The organization quickly initiated its protocols for investigating potential outbreaks, emphasizing the importance of timely information sharing in global health. The WHO's role is pivotal in coordinating international responses to health emergencies. With its extensive network of experts and resources, the organization provides guidance, support, and recommendations to countries facing health crises. In this case, the WHO's involvement was crucial in assessing the severity of the outbreak and facilitating communication between nations. As the situation unfolded, the urgency became increasingly apparent. By early January 2020, the WHO had convened an emergency committee to evaluate the outbreak's potential impact on global health. The rapid spread of the virus and its unknown characteristics underscored the need for a coordinated response. The WHO's actions during this critical period laid the groundwork for international collaboration, ultimately shaping the global response to what would become the COVID-19 pandemic. As the pneumonia cases in Wuhan continued to rise, scientists and health officials worked tirelessly to identify the underlying cause. By early January 2020, researchers isolated a novel coronavirus from patients, which was subsequently named SARS-CoV-2. The scientific process involved advanced techniques such as genetic sequencing, allowing experts to analyze the virus's structure and compare it to known pathogens. This identification was crucial, as it provided the first concrete evidence linking the outbreak to a specific virus. The implications of recognizing COVID-19 were profound for public health. With the identification of the virus, health authorities could implement targeted measures to contain its spread, including contact tracing, quarantine protocols, and public awareness campaigns. This knowledge also enabled the development of diagnostic tests, which became essential for identifying infected individuals and preventing further transmission. Globally, the recognition of COVID-19 marked a turning point in the response to the pandemic. It prompted countries to take immediate action, including travel restrictions and lockdowns, to mitigate the virus's impact. The identification of COVID-19 not only highlighted the interconnectedness of global health, but also underscored the importance of rapid scientific collaboration in addressing emerging infectious diseases. Following the identification of COVID-19, countries around the world swiftly initiated a range of measures to combat the emerging threat. The World Health Organization's notification served as a catalyst for action, prompting nations to implement travel restrictions, enhance surveillance systems, and establish quarantine protocols for travelers from affected areas. Many governments also ramped up their healthcare capacities, ensuring that hospitals were equipped to handle a surge in cases. The importance of global cooperation during health crises became increasingly evident. Countries shared data, research findings, and best practices, fostering a collaborative environment that was essential for understanding and mitigating the virus's spread. Initiatives like the COVAX program emerged, aiming to ensure equitable access to vaccines and treatments for all nations, regardless of their economic status. Public awareness and preparedness played a critical role in the global response. Governments launched extensive campaigns to educate citizens about the virus, emphasizing the importance of hygiene practices, social distancing, and vaccination. This proactive approach not only empowered individuals to protect themselves, but also helped to reduce transmission rates. Ultimately, the global response to COVID-19 highlighted the necessity of solidarity and preparedness in facing health emergencies, setting a precedent for future public health challenges. As the world grappled with the COVID-19 pandemic, a proliferation of conspiracy theories emerged, adding a layer of complexity to the global response. These theories ranged from the virus being a bioweapon engineered in a lab, to it being a hoax designed to control populations. The origins of these conspiracy theories are diverse, often rooted in fear, misinformation, and distrust of authorities. Social media platforms played a significant role in the rapid spread of these theories. With the ease of sharing information, both accurate and false, platforms like Facebook, Twitter, and YouTube became breeding grounds for misinformation. Algorithms that prioritize engaging content inadvertently amplified sensationalist and conspiratorial posts, further entrenching these theories in the public consciousness. The impact of these conspiracy theories on public perception and health measures was profound. Misinformation led to skepticism about the severity of the virus, resistance to safety measures like mask wearing and social distancing, and hesitancy toward vaccines. This not only hindered efforts to control the spread of COVID-19, but also fueled division and mistrust within communities. In response, governments, health organizations, and social media companies took steps to combat misinformation. Fact-checking initiatives, public awareness campaigns, and stricter content moderation policies were implemented to curb the spread of false information. However, the persistence of conspiracy theories highlighted the ongoing challenge of ensuring accurate information prevails in the digital age. Understanding the dynamics of misinformation and its impact on public health is crucial. It underscores the importance of critical thinking, media literacy, and transparent communication from authorities. By addressing the root causes of misinformation and fostering a more informed society, we can better navigate future health crises. In this video, we explored the emergence of COVID-19, starting with the initial pneumonia cases reported in Wuhan, China, and the subsequent identification of the virus as SARS-CoV-2. We discussed the critical role of the World Health Organization in coordinating the global response and the importance of international cooperation in addressing health crises. Understanding the origins of COVID-19 is vital, as it not only informs our current public health strategies, but also prepares us for potential future outbreaks. As we reflect on the lessons learned from this pandemic, it's essential to stay informed about health issues that affect our communities and the world at large. Knowledge empowers us to make informed decisions and contribute to public health efforts. If you found this video informative, we encourage you to subscribe to our channel for more content on health and wellness topics. Don't forget to like and share this video with friends and family to help spread awareness. Together, we can foster a more informed and healthier society. Thank you for watching, and stay tuned for our next video.